My name is Rich Olson. I'm an anesthesia provider at Alice Peck Day Memorial Hospital. And in this video, I'm going to discuss anesthetic care for total knee replacements. Sometime during your preoperative care period, you'll have two peripheral intravenous lines placed, usually one in the back of each hand. Shortly after the intravenous line placement, you'll meet an anesthesia care provider. The anesthesia care provider will do a very thorough medical history, assess your airway, and listen to your heart and lungs. He or she will then devise an anesthetic plan and discuss it with you. If you have any questions or concerns at this time, please bring them up. We will have you sign a consent form agreeing with the anesthetic plan. The usual anesthetic plan for total knee replacement is as follows. First, a femoral nerve block that provides superior postoperative pain relief. This will be followed by a spinal anesthetic with sedation. After the completion of your surgery, you will be brought out into the post-anesthesia care unit, otherwise known as the PACU. You will be monitored out here anywhere between 60 and 90 minutes. Using a model, I will now demonstrate the particulars of the femoral nerve block. The patient will be monitored. We use the standard monitors, blood pressure, EKG, pulse oximetry, and we also oxygenate. And then prior to starting the procedure, we will sedate the patient with two medications, Versed and fentanyl. These work very well to help the patient relax, reduce anxiety, and minimize any discomfort felt by the nerve block. In fact, at the very most, you might feel a slight pinch. The particulars of the block involve using an ultrasound device and a nerve stimulator to help identify the nerve and to help me locate the needle in just the precise area before I make my injection. This is done by taking the ultrasound probe, applying cold gel, and it is a little bit cold, but we will visualize the nerve with the probe on the groin area on the same side as the knee surgery. The nerve comes right out. It's very clear, right next to the femoral artery. This is the artery, this is the nerve right there, that white structure, kind of triangular in shape. After I've visualized the nerve, I will take a very fine needle with local anesthesia, place the local anesthesia right next to the probe, numb up the surface of the skin, and it's through that point that I will take my block needle, which is going to be attached to my nerve stimulator, and I'll pass it through that anesthetized area in the skin. And I will then direct the needle under ultrasound guidance so the tip is right next to the nerve. And I'll be able to see that on the screen. I will then verify that I'm in the right position by turning on the nerve stimulator, which will make your thigh muscles twitch as well as your kneecap. When I see that motion, I know I'm near the right nerve and an injection will be made. After the injection has been made, the block will meet its maximal effect in about 15 minutes. It doesn't work right away. It takes 10 to 15 minutes for it really to set up. After the performance of the femoral nerve block, the patient will be moved to the operating room where the spinal anesthetic will be administered. We will sit the patient up and get ready for the spinal. And the most important thing as far as positioning goes is the lumbar spine region. We want to see a round lumbar spine region. As you can see right here, our patient is sitting up with really nice posture and a nice lordotic curve right here. However, that makes spinal very challenging. We want this area of the back, the lumbar area, to be rounded more. Think about relaxing your shoulders, pushing your belly button towards your spine, and tucking your tailbone between your legs. This is beautiful. That will open the spaces up between your vertebrae. If you think of my fingers being vertebrae, when you're sitting upright, they're stacked on top of each other. When you bend like our patient is right now, it opens the spaces up and it makes it much easier for me to introduce my spinal needle between those spaces. Perfect position. So once the patient is in the perfect sitting position, the spinal can proceed. And that will consist of the anesthesia provider will palpate each hip, the top of each hip bone, and then come across to the midline and fill the spaces between the vertebrae. And the area we're going to work on will be anywhere from L2 down to L5. I typically like to work at the L3 to L4 level space. So once I feel with my finger the right space, I make a little mark with my fingernail. And that's where I'm going to do my spinal. And then I take some prep solution and sterilize that region. And it's cold and it's wet. So after I've done that, I'll put up a drape. This is all to ensure sterility. Next, I will infiltrate the area that I marked with my finger with local anesthesia in a very fine needle. You will just feel a very mild pinch and burn that will only last for a couple of seconds. Nothing severe. The nightmares you hear about spinal are really overrated. It should be minimal discomfort, and the worst part is just what I showed, just a little numbingness in the surface of the skin. It's through that spot that I actually pass the spinal needle. So I will go through that spot that I numbed up, and the spinal should just give a pressure sensation. You should not have any sharpness or any painful sensations during this procedure. Once the spinal needle is in the correct location, I will make an injection with the spinal solution, and we will then have the patient lie back down. And the first sensation you're going to feel is your legs are going to become very warm and tingly, especially your feet. Then that sensation is going to work its way up until the belly button rib region, and it's going to go from being tingly and warm to being numb and heavy. Your legs are going to be very sluggish, and after about 10 minutes you won't be able to move your legs at all. Now, the typical spinal lasts anywhere between 3 to 5 hours, and the surgical procedure lasts around 2 hours. So you got plenty of time with the spinal for the procedure. The other point to remember is after the procedure is completed and you're brought out to the recovery room, the spinal will still be working and your legs are still going to have no feeling and you won't be able to move them. That is completely normal. It'll take another hour to 2 before that spinal wears off. I will also mention that part of our spinal plan is we put morphine mixed in with our spinal solution, and that works up to 24 hours for very good pain relief. So the combination of the femoral nerve block, the morphine put in your spinal solution, and the PCA device will give you outstanding pain control throughout your recovery period. Now, the other part to the anesthetic, besides the spinal, is sedation. Though spinal is the primary anesthetic for this procedure, we also want you to be comfortable. We don't want you to hear noises and see anything or feel anything. So we use a wonderful sedative called propofol, which we give through your intravenous line through a pump, something like this. We will hook this up to your intravenous line, and we'll start the pump up, and it will gradually pump in the propofol. And you'll basically feel like you're falling asleep at night. You'll get very relaxed, and the next thing you know, the procedure will be over. And the beautiful thing about propofol is it wears off very quickly after we turn it off. And of course, we won't turn it off until the procedure is over. And then when we do turn it off, 5 to 10 minutes later, you wake up and you're going to have a nice, relaxed feeling. It's a wonderful sedative that doesn't have the side effects of general anesthesia. You won't have that nausea or hungover feeling, which is more common with general. You perhaps will feel rested, and some people even feel a little euphoric from it. It's not uncommon to have those feelings. So that is the anesthetic plan within the operating room. Once the procedure is finished in here, we will bring you out to the post-anesthesia care unit where you'll be monitored for anywhere from 60 to 90 minutes is typical. You should have very little pain. You should not have any pain really while you're in the post-anesthesia care unit. Between the femoral nerve block and the morphine that we put in your spinal solution, you should be very comfortable. At some point, you will need a patient-controlled analgesia device, and this will be explained to you by a perioperative nurse. I will not go into that at this time. I hope you have found this video informative and helpful, and I wish you the very best with your upcoming surgical procedure.